Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Thank you so much for joining us today, and we are thrilled to have back today Kathy Hatmaker, who is a nurse practitioner and does our aesthetics here at Our Family Health. And we are talking a little bit more about aesthetics and helping people understand. So we have done an episode where we talk a lot about the different types of procedures and what occurs and what they might be good for. And today I want to take a little bit of a different approach because it's helpful to know, like, if someone's saying, oh, do I want to get a PRP facial or what do I want to get Botox? What is that? But today we're going to take the approach of, this is what I don't like. What would fix it? What would you suggest? We definitely suggest that if you are interested in aesthetics, that you sit down with Kathy and she will help you. All you have to say is, I don't like the bags under my eyes. And she'll give you all kinds of options for different things that can help with that. And so that's what we want to do today is really, if there are certain common problems, what would be some of the common solutions? So thank you, Kathy, for joining us. I appreciate you being here and your expertise. So I'm going to throw a problem at you. You tell me what you would recommend as our possible solutions. So let's just start with one that is common for me, the dark bags, sunken, or puffy eyes.
So you can try preparation H under there.
Yeah.
Sometimes that will help,
So,
surprisingly.
People are always like, are you telling me to put something for hemorrhoids under my eye? Hemorrhoids are inflamed blood vessels. And dark bags under your eyes are inflamed blood vessels. And so anything that sort of vasoconstricts those vessels will take that color out and maybe some of the puffiness. And also inflamed blood vessels, any inflammation, what do we tell you to do when you have inflammation, puffiness? We tell you to ice it. So sometimes we'll say put preparation H in the refrigerator and then put a little dab and the cold will help. But anything cold in that, so people will put cucumbers from the fridge on their eyes. There are those nice little eye gels.
Chip bags.
Yeah. And I often tell people, like, put it in the fridge because the cold's just going to make it even more therapeutic. But you have to do, that's going to vasoconstrict for a few hours, maybe half a day. And
so
then
you wake
it's going to
up
go
with
away.
the same,
And then it's going to go away. And along those same lines, you got, fixing the underlying problem is always helpful. So getting a good amount of sleep and trying to make sure you're using a good skin product for kind of the fine lines and puffiness under your eyes is a great way to keep this on a regular from getting too bad. But if you're a person who's really like, I'm doing that, I'm using the creams and I'm using the over-the-counters and I've done the preparation H and I just have sunken, dark, puffy eyes, what are some of the more therapeutic things that we can
use carboxy therapy, the carbon dioxide therapy, which is very helpful for that area. Also, microneedling is helpful for that area.
And it makes good sense because we're going to stimulate the under layers to get some of the inflammation out, as well as to get the collagen reproduced to pull that tighter. So I think that really helps with sort of the fine lines and the sunken and dark discoloration.
Sometimes for the fine lines, you can do a little bit of Botox under the eye. Will help some.
And then we just had a fun conversation about how do you pronounce this. And so what was it? Gua sha.
Stone.
Which, like the stone that you can rub your under your eyes. And Kathy said she's seen that really does work when people use it. I'm assuming that's something that you use regularly. Like it would be a part of your regular skin
nightly.
care. Yeah. and that might help with daily to kind of help with this constant problem.
Yes.
Perfect. And I remember when I was a resident doctor catching a glance at myself in the window going, oh my gosh, when did I get such bags under my eyes? Because I hadn't slept in days. And so, I think lifestyle contributes to these things, but there are some great things that we can do to assist. While we're talking about the area of the eyes, very common problem are what we commonly call crow's feet. So sort of those wrinkles that are lateral or at the outside of our eyes. What is the solution for getting rid of crow's feet?
Everyday Botox.
Yeah, every day. It's not that you have to get Botox every day, but the answer every day is Botox.
Right.
Absolutely.
Botox.
It really is. Because
paralyzes the muscle and
absolutely
relaxes.
Gets rid of those crow's feet. And I think it's a phenomenal difference when people have those really kind of, and it is genetic, and there are, things that we can't control. But when people have really pronounced crow's feet and they get Botox, it is remarkable how much younger they look. And so while we're talking about this sort of upper area, we also have like the distinct 11 lines that make us look angry when we're not. That's the kind of number 11 that sits between our eyebrows. Solution for that?
Botox.
Botox paralyzes that muscle that's grabbing and pulling those 11s. And just, you can see that go away. How long, if you were to get Botox for crow's feet or 11 lines, how long does it take before you really see a therapeutic benefit from the Botox?
So it starts about 3 days after you've received the Botox, and then it maxes out at 14 days. You need to come every 12 to 16 weeks to have more Botox, but as you continue to get it, you should need less units.
So yeah, I think, people keeping in mind that getting Botox every 3 or 4 months, and that really helps. But Kathy's been giving me Botox for so many years. I love when I would be so slammed with patients. Kathy would come see us as a patient, and then she'd run in and give Amber and I Botox in between our patients. Like, I've got 3 minutes. Can you do my Botox? Yeah, of course I can. So I at first I would really like at a 3-month mark be like, oh, I need my Botox. But now, 4 or 5 months, it's less dramatic how much the wrinkles come back. And you can get fewer units over time.
Right.
And so Botox really is the solution for the forehead, the 11 lines, the crow's feet. That's really where we're going to see relaxing those harsh wrinkles.
Take years off.
Yeah, it really does. It takes years off. And a total cost for Botox, if I were to come in and say, just make me look younger up here, up on the forehead, the crow's feet, all of it, average cost, that's, 30 to 50 units, depending on how strong your muscles are.
Yes.
Men sometimes require more.
Yes.
Because they have strong muscles. And so you have to use a little bit more of the paralytic to get it to relax. So it can be more expensive for men. It's probably one of the few things that's more expensive for men. But in general cost, maybe $300 to $500.
3 to 5.
Yeah. Every 3-4 months. So some of the other common problems that people might say, oh, I really hate this, around the mouth. So we can get these really sunken, sometimes called marionette lines, because they can look like the lines on the face of a dummy, a marionette. And maybe the wrinkle lines. Smokers get it really bad, the pucker lines. We're all drinking out of these really beautiful Stanley cups now that have straws all the time, so we may be getting a little bit more of the pucker lines. But what do we do to try to fix either? Well, first let's start with the marionette lines.
So you can start with Botox to see if you can relax the depth by relaxing the muscle. And the marionette lines, you can put a little Botox in the DOA so that it will turn your smile,
So
your frown into a smile.
I'm not frowning, but I look kind of gravity's pulled things down.
Yes.
Yeah.
So that will look better. You can also put a little bit around the lip that will make it flip and reduces those lines. You can also use filler, which lasts longer.
And so filler will last about how long?
So fillers last about 9 months to a year. sometimes longer.
And you're going to get a more dramatic effect from the
Yes,
filler than you
immediately.
are the Botox. And so I think advantage of filler is it's going to last longer, and you're really going to see a more pronounced effect. So if you're like, I really hate these really sunken lines, then you're going to get the effect you want more from filler than you might from Botox.
Botox, yes.
But filler's going to be more expensive.
Yes, but they last.
Yes, when you say you don't have to repeat it in 3 or 4 months, it may end up being similar.
Right.
And so then what about I want fuller lips?
Dermal
I think
fillers.
super common now. Dermal filler is how we get the big, kissable, plump lips.
Yes.
And the dermal filler for the lips, what is the difference in a lip flip for Botox versus getting fillers for someone's lips?
So the lip filler will make your lip come up a little bit.
The lip flip, the Botox lip flip.
Yeah, makes it flip out a little bit. Whereas the filler is going to give you volume, give you a bigger lip.
So that Botox lip flip kind of gives you that little pucker kind of appearance, where the filler is going to give you a general fullness of both upper and lower lips to have sort of the larger lips.
And you can do them both at the same time.
Okay, so if you want the pucker and the fuller lips, then you do both. Okay. And same with the lips. The filler will last in the lips how long?
It will last 9 months to a year.
Okay. And then these things naturally dissolve, right? The filler sort of dissolves over time. As far as other common problems, what about the neck? You know, lots of times we do things to our face, we wear makeup on our face looks better, but then our neck ages us.
Yes.
And so when we sort of have the droopy, crepey, making us look older neck, what are our options there?
So we can Botox the platysmal muscles, which actually give those jowls a break, and so you don't see the jowling as much. If it's texture and sagging, we can do the microneedling for that area. Also the carboxy, the carbon dioxide therapy.
And so all of these collagen inducing, the PRP you'll do on the neck as well, and all of it helps to kind of induce the collagen to pull things tighter.
Yes, and also your daily regimen.
And Obagi has I've noticed some difference, because this is always an area of concern for me. And Obagi has a great neck
elastin.
Elastin, yes, and kind of helps generate more elastin, which pulls things tight. And it's remarkable. Some of the before and afters with using that product are really remarkable. And so other common issues or common problem would be people who struggle with acne or have scarring from acne. I think, you know, as far as acne goes, we want to be careful to make sure that people understand when they actually have inflamed acne. Acne is a bacterial infection of your pores. And so this isn't something that you want to do a lot of manipulations. You're not going to do a microneedling or a dermablating. Yeah, because you're really just going to spread the bacteria and you're going to create more issues and infection. But when people have acne, there are lots of good topicals. And I really believe we don't do Accutane here, but I think speaking to a dermatologist about Accutane, if people have cystic acne, is a great solution to not be too overwhelmed or discouraged from. It's worth the conversation, because cystic acne is such a powerful impact on people. When you have acne on your face, it's just a struggle. It's just a struggle, and I think we forget about how that affects people's self-esteem. But post-acne scarring, there's a lot we can do in medical aesthetics for. And so what are some of the solutions for the acne scarring?
So the number one FDA approved is the microneedling. And the PRP with that helps. A session of 3 or 6 until you get to your desired results.
And
but
then
it
that
does make a lot of difference.
Once you get that resolved, it's not going to, as long as you don't have a continued issue of acne, it's not going to come back. So this could be a lifelong solution, which is profound, which is an amazing thing. Are there other things that I'm missing as far as when people come in and talk to you or do a consultation and they're thinking, I just hate this, I'm trying to come up with the comments, but you talk to these people about this. Anything else that stands out?
No, a lot of people have the trouble with the eyes. That's a difficult area. And a lot of people just wait too long.
Yeah. Yeah,
So,
that brings up a really valuable thought is a lot of our 20 and 30-year-olds are being very proactive about aesthetics. And they're doing facials and they're doing medical facials and
start early.
Yeah, and starting early because it's really allowing them to be able to do these things less frequent. And when it's preventive medicine of any sort, when we can prevent issues, it's so much easier than having to fix the issues once they come. And
Right.
so I think the being more proactive with earlier Botox and earlier collagen inducing and hyaluronic acid treatments is huge for helping people to be able to not end up with the problem that they're trying to rescue themselves from, but also it's an easier
Right,
fix when we
right.
don't let it go too far. Yeah, start early is excellent advice.
Yeah, I think our generation was not taught to care for your skin. We just weren't taught. So earlier, the better.
I agree. And, it's interesting when I talk to friends from Europe and Australia, they
yeah.
have such a different approach. From a young age, they're taught about skincare products and sunscreens and a daily skin routine. And it's nothing for them to be getting these kind of, I'm going to the dermatologist, I'm going to the medical spa. But I think in this country, we're sort of made to feel guilty about it.
Exactly.
I
Yes.
think aesthetics in general and self-care in general is something that I think our generation feel like we have to hide. And it's fine if it's none of people's business what you're doing to look beautiful, but I think also be proud. Don't have shame in the fact that you love yourself
yeah.
and that you want to take care of yourself. And I think doing aesthetics is a way to take care of yourself, just like exercise and eating right is a way to take care of yourself. And as we say that, it also reminds us that some simple habits that really help with your skin are staying well hydrated and making sure that you have good nutrition, because skin, like anything, is a organ that is turning over. And if you don't have the nutrition for the new cells to be produced, then, so the hair, skin, and nails, vitamins, and the
Pure.
biotins. Yeah, we sell a pure encapsulated hair, skin, and nails. Has wonderful things in it that are the building blocks, because we can try to stimulate things all day, but if you don't have the building blocks, you can't build it. So making sure that you're eating right, that you're staying well hydrated, and that you're taking some good vitamins is excellent advice for keeping you looking good as well.
I feel like sometimes you just can't change the genetic,
It's absolutely
but you can start early and it helps prevent.
Yeah, absolutely right. So our overall stretching advice would be take good care of yourself, eat right, make sure you're staying well hydrated, use a daily skincare routine with good products. And please know that there are a lot of expensive products that might not be good products. And so lots of times med spas will have medical grade products. We sell Obagi, which is one of those medical grade products. There are other good ones. But making sure that when you are spending a lot of money, that you're spending it wisely. And then when you have a specific area that you feel like, I just hate this, go get it fixed. There is no shame in being able to see that you want something to be different and doing something to make it different. We love helping people. You have seen so many people where they're a little self-conscious about something, they get it fixed, and they just have a different glow and a different confidence.
Different outlook.
Yeah, a different outlook. I love it. Well, thank you so much for taking us through this today, Kathy. We appreciate all of you listening, and please join us again on our next episode. We'd like to leave you on a good note. So today's Tell Me Something Good is brought to us by our employee, Amanda. Amanda says that something good for her are hyacinths. I agree, hyacinths are beautiful. Amanda says that they were her grandmother's favorite flower, and they always bring back memories of her Nana. I like hyacinths because they're about the first flowers to bloom, so it reminds you that spring is coming, or spring is here. Thank you so much for joining us today, and until next time, take care of yourself.